I'm curious to find out if your research has shown what are some of the, as you mentioned before, like what are some of the mitigating factors? What are some of the things that people can do now to implement if they've already had this slightly socially isolated group in their facility already? What can people do, both from a residential aged care standpoint, and perhaps a community standpoint as well? Because I think when people think of aged care, it's like, okay, residential only, when really it's like residential represents a very small part of it, though there's still quite a lot of people in it, but community is quite a large proportion of aged care as well.
I'll start, but you're right, Nick, it's wild that this is not considered an issue in the same way as like biomedical health, that we are still kind of using this outdated framework to view well-being in aged care. And that was evident in the Royal Commission, that there was only 2 recommendations out of 148 that specifically relate to social and emotional well-being. But yeah, so I guess it is raising awareness that this is important. Like, even on a personal note, I was meant to go to a workshop around social connection for older people in residential aged care, and they had to cancel the workshop because there wasn't enough people in attendance. So weirdly, we do care about social isolation and loneliness. We just don't care about older people in residential aged care, which is indicative of our ageist society that we live in. And I'm hoping that through dialogue, this is starting to change, or this will shift culturally in the next, 10 years.
I think to follow up on that as well, like they do, the aged care providers do depict to us. I mean, they have said to us it's like being on a cruise ship, as I've mentioned before, and that they come up with these programs of activities, and they're often, these people are called diversional therapists, which was quite confronting to me when I first heard the term, because it's like, okay, you're not trying to connect people, you're just trying to divert them, their scenario. But anyway, they have these like activities where it's quite individualistic, like bingo or something like that. And so a lot of our work on social connection more generally is about how there are specific activities you can do with people that help them to connect and to form relationships. And I think Jasmine has been finding that some of the literature talks about how when people are older, they're more focused on their existing relationships and they're not open to making new relationships. But in the work that you've done, Jasmine, you found, didn't you, that people were actually quite open to making new relationships. Do you want to talk a little bit about the kind of small study that you've done and what your responses were from people?
Yeah, definitely. So I worked with the Salvation Army and Uniting on this kind of feasibility pilot for a social connection assessment tool. And we tested it, we created it with residents and staff, and we tested it on, I think it was around 50 residents. But we found that residents, it was like 64% of residents were interested in meeting new people and making new connections.
Wow.
And what I was really shocked was, which I guess I shouldn't have been shocked, but I was, how much life there is in these spaces. Like they had these social goals that they wanted to pursue. They wanted to visit places in the community more regularly. They wanted to maintain and build new relationships. They wanted to learn new things. Some wanted to travel. So I think we have this kind of misconception that it's too late. It's too late for people. People spend nearly 3 years in these spaces, which is a really long time if you're in social isolation and loneliness.
Yeah, 100%.
I think it's partly, Nick, just to get back as well to, as we've got this big program, of social connection research, and it's partly that Australia is not a very collective kind of society. And so we've been looking at people who are migrants in outer metropolitan suburbs. And a lot of these people who maybe come from quite collective societies where they've come from, Ethiopia, Eritrea, some of these countries. And when people come here, they bring that collectiveness with them. And they're able to kind of generate it. And you can really see the difference between them in all of these interviews that we've done in outer metropolitan suburbs with more your kind of long-term Australian resident who's kind of saying, as I kind of said earlier, well, I've got all these contacts, but I don't really have these close contacts because actually there's very little collectiveness left in our society. I mean, essentially church is really the only kind of activity that's like a system. It's like a kind of system for connection, right? And I mean, even the number of people who attend church regularly has declined a lot, but we don't have civic volunteering has declined, trade union membership has declined. I mean, all of this collectiveness has declined because everybody's desperately trying to pay off the mortgage. And so I think what we see in aged care and the way that people regard aged care, who you are making policy or whatever, is a kind of continuity of that, in the sense of like, okay, well, these people have reached this stage of the life, we'll just package them up and put them over there, we'll just park them over there, because that's the point that, you know, where they are, sort of thing. So it's a kind of fundamental thing in the fabric of our society, and it's just being followed through to the end of life or nearing the end of life, I think.
So I'm curious to hear. Oh, sorry, Jasmine, you go.
Sorry, I was going to jump in. I think that it is so important that we make these spaces more conducive to connection. Like, someone has spent their entire life, hopefully having a lovely life, or a miserable life, who knows? But to spend your final years in such a desolate, depressing headspace and then to leave is just really sad. But also, I want to say, connecting with people is difficult. It's a hard thing to do.
Absolutely, yes.
But there are, through the research and the work that Jane and I have done, we know that there are things. There are activities, there are spaces and places, there are people that facilitate and help connection. So there are mechanisms behind the process that can be introduced into residential aged care facilities, so that it does make it easier and smoother for people to have these really meaningful connections.